Hi, my name is Betsy Scott and I'm a registered nurse at the Swedish Cancer Institute. With a special thanks to the American Cancer Society for writing this article, I am able to bring this podcast to you on Talking with Your Doctor. Hearing the words "you have cancer" is overwhelming, so you want to make sure you get all the right information from your doctor. In the future, this will help you to be a better advocate for yourself during treatment. All of the content in this podcast has been provided by the American Cancer Society. After your cancer diagnosis, it is important that you feel comfortable with your doctor. It is very likely that you will have more than one doctor. In fact, you may have a team of doctors and nurses taking care of you. You will probably get information from all of these doctors, but it is important that you find one doctor out of the group that you can go to for questions. You should feel at ease with your doctor. Feeling comfortable with your doctor may take a little time and work. Take the time to ask the questions and make your concerns known. Likewise, your doctor should take the time to answer your questions and listen to your concerns. If you and your doctor feel the same way about sharing information and making choices, you will probably have a good relationship and your needs will be met. One major question you should ask yourself before your appointment is, how much do I want to know? Having an idea of how much you want to know is the first step towards feeling good about the conversations you have with your doctor. You may want to know a lot of medical details about your cancer. Some people feel more in control of what is happening to them when they know all of the facts. Decide how much detail you would want to know about the cancer and your treatment, and then after you've decided, let your doctor know. You may want only small amounts of information. Some people get upset and overwhelmed when there are too many details. They may want simple directions such as what pill to take or what their treatment will be and when it will be done. They feel overwhelmed by medical details and would rather leave most decisions to the doctor. On the other hand, others want to know everything. They may want to talk over the pros and cons of all the options before they start any kind of treatment. Don't be afraid to tell your doctor how much or how little you want to know about your cancer treatments. It's hard to understand complex information when you are anxious or afraid. Sometimes, without knowing it, doctors use words that their patients do not understand. If you do not understand something, ask your doctor to explain it to you. Even if the doctor carefully explains things, you may not hear or remember all that is said. Here are some ways to help you remember everything your doctor tells you. Decide which way will be best for you. One way is to take notes on what your doctor says. You can ask if you can record your conversations. Take a family member or friend to meet with the doctor. He or she can remind you of the questions you want to ask and help you to remember what the doctor said. You may want to take along the person who talks to your family about your health. This will keep that person informed and help your family feel included, but keep you from having to answer a lot of questions. You may want your family's help in making decisions, so keeping them up to date may be a very good idea. It's a good idea to keep a list of questions you think of in between your visits and to take them to your next appointment. Here are some questions to ask your doctor during the initial appointments. Also, keep in mind that the nurses and other members of your healthcare team can answer many of your questions too. What do I have? What is my diagnosis? What treatments do you recommend? Are there other treatments? What are the benefits of these treatments? What are the risks of these treatments? What medicines are you giving me and what are they for? How should I expect to feel during treatment? What side effects, if any, can I expect to have? What can be done about the side effects? When your doctor gives you instructions, write them down. Make sure you understand them before you leave the office. You will need to follow them exactly. Here are other things you may want to discuss with your doctor before and after treatment. How will treatment affect the important things in my life? Is it okay to wait to start treatment? What is the best time to call if I have a question? Who else gets the information about me? Remember, always tell your doctors about any effects from your treatment or from the cancer itself. Physical symptoms can be very important for your doctor to know about during treatment and even after treatment. People with cancer may have trouble with pain, breathing, sleeping, nausea, appetite, their bowels, feeling tired, or other problems. Many discomforts can be prevented or made less of a problem with help from your doctor. Tell the doctor what kind of symptoms you're having and then exactly how it feels. The time of day you usually notice this symptom, how bad it is, where you feel it in your body, how long it lasts, what, if anything, makes the symptom better or worse, and in what way or ways it affects or interferes with your daily life. If you keep having problems, let your doctor know what works and what doesn't. Most people have to try more than one way to get symptoms under control. Cancer treatment is so complex, and some people don't know where to start asking questions, but they may wonder if another doctor might offer something different in the way of treatment. You may find that you want to talk with another doctor who can look at your test results, talk with you about your personal situation, and maybe give you a different take on it. Some people find it hard to tell their doctors that they'd like a second opinion. It may help you to know that it is common for patients to get a second opinion, and that most doctors are very comfortable with the request. In fact, some insurance companies require that you get one before you start treatment. If you are unsure how to begin, here are some ways that may help you bring it up with your doctor. Before we start treatment, I'd like to get a second opinion. Will you help me with that? Or, if you had my type of cancer, who would you see for a second opinion? Or, I think that I'd like to talk with another doctor to be sure that I have all my bases covered. I'm thinking of getting a second opinion. Can you recommend someone? Once you've decided which doctor you will see for your second opinion, ask that your medical records, your original x-rays, your test results, and records can be shared with the new doctor. This way you won't have to repeat them. You will probably need to ask the doctor's office staff to help you with this. You may need to sign a release of information form to have the records sent, or you may want to carry the medical records to the new doctor yourself. If you have problems talking with your doctor, there are often ways to make things better. Try working out your concerns before deciding the situation is hopeless. First, state your concern as honestly and openly as you can. Here are some ways you may want to think about starting the conversation. I'm concerned that we aren't communicating well, and here's why. I need to be able to talk with you about something, and I feel that I can't. Can we discuss this? I realize that you're very busy, but I need to discuss X with you. Can we schedule a time to do that? Or, I'm having trouble understanding X. Can you help me? If you need more details after your doctor answers a question, say so. Sometimes it's even helpful to ask the same question again in a different way. Unless you tell your doctor that you don't understand something, he or she will probably think that you do. There's nothing wrong with telling your doctor that you don't understand. If you want to learn more about your cancer treatment, ask your doctor to suggest some reading materials. Keep in mind that nurses can be great sources of information too. Learning more information about your treatment can help you become more actively involved in it. If you are unable to work out the problem with your doctor during regular visits, ask for a special visit to discuss it. Even if you feel frustrated or angry, try to avoid being hostile towards your doctor. Often people become defensive and withdraw when they feel attacked, and this is a response that will not be helpful in the long run. State your concerns and questions clearly and honestly without accusing your doctor. If the situation and your feelings do not change, it may be time to find a new doctor that is more suitable for you. Don't stay with a doctor only to protect his or her feelings. Just because you were referred to the doctor does not mean you can't decide to change doctors on your own. It's your body, and you have the right to find the best doctor that is suitable for you. Overall, it is very important to be able to talk with your doctor. Thank you very much.